Namaskar and welcome back to one more episode of Top 10 Questions. Now, I have to tell you very honestly, I'm very happy and excited about today's topic because this is one of the topics about which I find the maximum amount of confusion, different opinions, confusing scenarios exist in people, and that is thyroid surgeries. So this is one of the most common surgeries that is performed by ENT and head and neck surgeons, general surgeons and thyroid surgeons, and also cancer surgeons. So it's a very weird thing. Okay, I have a swelling or a lump in my throat. Which doctor do I go to? Who is the right doctor? Who is the correct person? And everybody keeps saying that, oh no, I am the right guy to do this. And so it's a really confusing scenario. So today, instead of confusing you further, we're going to aim to answer the top 10 most common questions that people ask us when we need to talk to them about a thyroid surgery. So let's get into that right now. Before we answer this question, let's understand what the thyroid gland is. So the thyroid gland is a butterfly-shaped gland that sits in the front of your neck. That you can go and get from Google or Wikipedia. The basic question becomes, what does the thyroid gland do? So the thyroid gland does nothing and does everything. So that means you can think of a thyroid gland as sort of like the coolant in your car. That means that it doesn't really do anything by itself, but it keeps the engine functioning. So like a coolant or an engine oil in the engine, this is what makes the engine of our body function. So it creates a situation where all the parts of the body, all the processes in the body can take care. For example, forming new bone, you need the thyroid hormone. For digesting food, you need thyroid hormone. For metabolizing things, you need thyroid hormone. For muscles, increasing and repairing your muscles, you need thyroid hormone. So the thyroid hormone is like the master hormone. It is needed to keep your body running. Now, the most common reason for thyroid surgeries is a lump in the neck. So somebody either comes to the doctor because they have a swelling in the neck, or you went to the doctor for something else and they did an ultrasound and they found there was a lump in the neck. Now, these lumps can be two things. They can either be a cancer or they may be a non-cancer thing. So in both of these cases, there are different reasons why we may need to talk about surgery. But the fundamental thing that we need to answer is thyroid surgeries are done for two reasons. One, there is a cancer in the thyroid, or B, there is no cancer in the thyroid, but the thyroid gland is becoming large because of either a non-cancer tumor or some other condition that is making the gland very large. In these situations, because the gland is becoming large, it starts pressing on your windpipe. It can also start pressing on your food pipe, and it can start pressing on the nerve that controls your voice. All of these three things can create difficulty in swallowing, difficulty in breathing, especially when you lie down, and change in voice. These can also, as they keep growing, can start to go into the chest from the neck, at which point that becomes another dangerous thing, because once it goes into the chest, it comes in contact with all of the big blood vessels, big nerves, important structures of our body which are in the chest area. So to sum up, thyroid cancer surgeries are done to remove the cancer. It is as simple as that. And because thyroid cancers do not respond to medicines, they do not respond to radiation, the only way to remove them is by doing a surgery. And non-cancer thyroid issues are removed because by their sheer size and the fact that they're growing, they can cause major complaints for our patients. So let's take the case of thyroid tumors first. Now, one of the things that is said about thyroid tumors is that if God has cursed you that you have to pick one cancer, the cancer you should pick is a thyroid cancer. The reason being that thyroid tumors or thyroid cancers are one of the only cancers in our body in which case, as long as they're within the gland and they have not spread out of the gland in the rest of your body, when we remove the gland, we talk of cure. Remember, in cancers of the mouth, cancers of the neck, these areas we can't talk about cure. Quite simply because medical science is not advanced enough at this point for us to give you the guarantee that we've cured you. So even after removal of the cancer and doing everything else, we talk about 5-year survival. That means that, okay, if you live for 5 years, then most likely we have cured you, but I have no way of being sure. That is not the case with thyroid tumors. As long as thyroid tumors are identified when they're still within the thyroid gland and the gland is removed safely, that is a curative thing. So this is why when we identify thyroid tumors, irrespective of whether that is causing you issues in your breathing, sleeping, change of voice or not, almost every single doctor who's following the modern guidelines will be telling you that you need to get a thyroid surgery done. Now, the specific kind of surgery keeps undergoing changes as we learn more about the thyroid cancers. In the past, the simple adage was, if there's a cancer, you remove the entire thyroid gland. But with more modern technology, we've come to the place where about 30% of cancers, as long as they're in the early stage and are matching certain criteria, we can remove only a part of the gland while keeping the other half of the gland intact. This helps us because if we remove the thyroid gland in total, we have to keep giving you the medicine, which is basically a synthetic form of the thyroid hormone, which you have to take lifelong. But if we can leave half of your gland, then you do not need to take any medicines. Effectively, you get back to living a completely dependence-free life. So there are specific things that keep changing, and certain doctors will be comfortable with following the more newer guidelines. Sometimes doctors may say that no, I'm not comfortable doing this because my patient is coming from a village, they may not be following up, I would rather remove it, and that's completely fine. These are judgments that are taken by each doctor, but every doctor will be telling you that they need to remove thyroid tumors. So that would be the reason for removing thyroid cancers, because A, if they're small, the surgery is small, the dissection is very, very easy and quick, recovery is very easy, and you're basically looking at a almost 100% rate of being cured. Of non-tumor thyroids, the surgery is still required in many cases. And the reason here is already something that we discussed in the earlier segment. In thyroid surgery, there is a classic thing that we say as doctors, that is the earlier the better. That means that if I see a thyroid lump or a swelling in the neck, then I know that swelling has come. Because if it was there for a long time, you would have identified it. So it may have come slowly, but it is definitely growing. Now, if a thyroid lump is growing in that scenario to the point where it is visible, in that scenario, it is always a good idea to go ahead and remove these glands. The reason being that the thyroid gland sits in a very close location to the windpipe, the food pipe, and the nerve of your voice. So if your tumor or the lump or the nodule that you're removing is small, your dissection becomes very small. Your entire scar is hardly a 1 centimeter size scar. And with today's day and age techniques, these scars heal up very quickly. They can be hidden in the creases. You don't have stitch marks, as you can see with these pictures. And basically nobody will be able to even tell that you had any kind of surgery done. But if the tumor becomes bigger or the nodule becomes bigger, then we do need a bigger cut to do the dissection. If I have to do a much bigger dissection, then the healing time for these surgeries become higher. The risk for injuries to the nerve become higher, and also the longer this huge heavy thyroid sits on the windpipe can start damaging the cartilage of your windpipe, which is what holds the windpipe open. So that if a tumor has been sitting for 20 years and I have to remove it after 20 years, because of these 20 years pressure on the cartilage, this windpipe may become floppy. So once I take off the thing that is holding it up, this windpipe may collapse, and this is called tracheomalacia. So because of all these reasons, if you do not have a tumor in the thyroid, but it is growing, or it has become visible, or it is starting to show any kind of symptoms, or we are worried it is in such a place that it will go into the chest or go close to the nerve of your voice and make the surgery difficult by waiting, in that scenario it is really not worth it as a doctor and as a patient who's suffering from it to unnecessarily grow it. Now that comes with the concept that, let's say someone's age is 75 years and that person has a stroke, has a kidney issue, something like that, where I'm not expecting that you're gonna see a long life ahead. In that scenario, we can take a shot. But if you're a 30-year-old lady or a 35-year-old lady, what is my long-term plan? Just because it's not bothering you today, if I leave it, I'm not going to get 45 years without you needing the surgery. So that means that I'm not taking you as a person and being able to avoid surgery. I'm just delaying the surgery. So by delaying a surgery by 3, 4, 5 years, there are two major things that happen. One is that the tumor grows. The surgery, which could have been a much smaller, much safer, much simpler surgery, becomes a bigger surgery. And number two is that your health, your fitness at 30 is definitely going to be more than your fitness at 40, except for few conditions. Again, your fitness at 40 will be better than 50. So as we keep going ahead in time, your fitness decreases, the tumor size increases. So these are the reasons why non-tumor thyroids also, once they're visible, or they're growing, or they're starting to cause any symptoms, or their location is such that as doctors we are worried that they will start affecting either of the important structures nearby and make the surgery more complex. These would be the reasons why we talk about removing them. So in the previous sections, we already discussed about the risks of thyroid surgery. Now, thyroid surgeries are extremely well-known surgeries, and if any surgery has been there for a while, that means that as doctors, we have had time to learn about the risks, the complications, all these things. So thyroid surgeries are basically some of the safest surgeries that are done. Now, that means that in high volume centers where we are doing a good number of these thyroid surgeries, these are very stress-free surgeries for the doctors. But that doesn't mean that we go into these thyroid surgeries in any way overconfidently, because every single person, there can be different issues. So what are the steps that all good doctors we take to make sure that it is not risky? So the first few things are, of course, not doing any unnecessary surgeries. Second is, when we're doing the surgeries, making sure that we review all the patient's documents, everything, so that there's no fundamental things that we have missed out. Now, once that is there, we come to the point of how do we make this surgery safer. The first step that we take in these surgeries is we do an ultrasound of the thyroid before we do the surgery ourselves. And that is a very critical thing. It's called intraoperative ultrasound, because that not only shows me where the gland is in the correct position, so it allows me to make my incision exactly the size that I need, which if someone else has done the ultrasound and I've just seen the report and I'm operating, it is not easy for me to judge the exact incision size. It may become bigger, it may become too small, so it's a little bit difficult. The second tool that we always use when we do this is the ultrasound, because the other thing that the ultrasound tells me is where are the big vessels of the neck. Remember, the thyroid gland sits just next to the big blood vessels. So sometimes if the thyroid gland is growing, it can make the blood vessels fold right in front of the neck under the skin. And if you have not done the ultrasound, you have no way of knowing if this large blood vessel has moved in an abnormal position. So if you don't know and you don't expect it and you start doing your surgery, you can end up in a major complication. But doing the ultrasound allows us to get a very clear three-dimensional map of where which important structure is and how we need to do the surgery. The second main thing that we do to take care of all our patients is that we use something called as nerve monitoring, which basically allows us to know where these nerves that control the voice are. Remember that while in a normal situation, almost every doctor will be able to identify where these nerves are. These thyroid lumps or tumors can stretch the nerves so that they can become very thin, like a small ribbon, which may be missed out by even the most experienced or careful surgeons. So this technology allows us to always be sure that we are not accidentally cutting or damaging the nerve. Moreover, once we have finished the surgery, we can check the nerve and make sure that the nerves are working correctly, which helps guarantee the safety of the surgery and to guarantee that our patients are going to do well. There are other factors that we need to be careful of. There are other glands nearby which have to be monitored, but those glands usually to be damaged accidentally with today's techniques is very, very rare. The main two complications would be this, which are taken care of. Now, thyroid cancers or thyroid surgeries with smaller glands are extremely safe, whereas if they become a bigger gland, then you need to take even more precautions, CT scans, MRIs, partial resections, different kind of things to make sure that you can do it without taking any risk with your patients so that they can go home safely. I think we already discussed this in the last segment, so we're going to keep this really short. If not doing a thyroid surgery has a good enough chance that I will never need to do the surgery in a later stage, that means the patient, I don't expect them to live for a very long time, unfortunately for some other reason, or the tumor is not growing in repeat checks and it's not visible, so then it's absolutely okay to not do a surgery. But if you are in a situation where the person is going to need a surgery later on, 2 years later, 3 years later, 4 years later, it is one of the worst things that we can do as a doctor and as a patient, because there is no other tool that can take a person who needs a thyroid surgery and convert it into the person not needing the thyroid surgery. The only thing that you will be able to do is we're going to be able to make it more complicated, more risky for the patient, and more time consuming for the doctor. So because of these reasons, we always recommend that if you do not need a thyroid surgery, absolutely no doctor should be telling you to get a thyroid surgery. But if a doctor is telling you that you need a thyroid surgery, get a second opinion, get a third opinion, get a fourth opinion. But if a doctor is telling you, no, all the other doctors who are saying you need a thyroid surgery are wrong, and I am the right one because I'm telling you don't need a surgery, then it will, if I was the patient, I would ask them, then doctor, what is your secret? How are you going to avoid me needing a surgery? It cannot just be I will give one medicine by which I will melt it, because if such a medicine exists, then that would probably make me extremely famous and extremely rich. So if that is not there, then you're probably getting delayed and converting your body into a much more risky situation. So in that case, I would recommend that take multiple opinions, but don't unnecessarily complicate something that is not very complicated to start with. So there are two different schools of thyroid surgeries. One is the classic traditional surgery wherein we make a small cut and variations of it. That means that the cut in the neck that you need for a thyroid surgery, there are different techniques to reduce the size of the cut, which are called mini-invasive video-assisted thyroidectomies or MIVAT techniques. Now there are multiple groups of these. All of them function in the same way, that you make a cut that is big enough to take the thyroid out, but where you need to dissect in the grooves where you can't see, you use an endoscope to see there, and then you dissect the thyroid from those regions. So this reduces the size of the scar to a much smaller scar, but it still will cause a scar. The other group of techniques is where the thyroid is removed without any scars at all. Now that means that the doctor can come to the thyroid over here, by making a cut in the mouth, which are called transoral surgeries, or they can make a small cut in the armpit here, which are called transaxillary approaches. So if you make a cut here, you make a small tunnel here and you go ahead and remove the thyroid. If you're coming from the mouth, you come from here. So now the question becomes, okay, if there's an approach that leaves me with a cut, and if there's a way to remove it without making a cut, I mean, isn't it obvious the one without the cut is better? Not really in these cases. Now, yes, if there is an approach that makes a cut and one that doesn't make a cut, the one without the cut is better, provided it does not add up other complications or other issues. And this is where the fundamental problem comes with these scarless thyroid surgeries. Scarless thyroid surgeries, almost all of them increase the operating time by nearly 2.5 to 3 hours. The reason being that you are reaching something here from the mouth or from the axilla. Because of the increased operating time, you are under anesthesia for a much longer time, so your recovery takes a much longer time compared to a small cut and removing. The second thing is that with today's techniques, these scars have become practically invisible, because in today's day and age, these scars can be closed with glues and in such ways that there is no stitches on the skin. So once there's no stitches on the skin, these scars basically heal exactly like your neck creases. So they become practically invisible. So the question becomes that if there's a technique that is very safe, very less dissection in the body required, very quick healing, and scars become practically invisible, does it really make sense to go ahead and do a much more roundabout approach, which increases the patient time, which increases the cost of surgery nearly 2.5 to 3 times, and which frankly can increase the hospital stay compared to a simple thyroid approach? In certain parts of the world like Korea and all of these places where there is a lot of social value that is placed to the neck, it may become worth it simply because of the fact that women with any kind of neck scars are at a major disadvantage. But in a country like India and in most other countries around the world, one of the primary reasons that high volume thyroid surgeons prefer to do most of their surgeries straightforward with the small cut is because it's just a much safer, quicker alternative for our patients. And from my perspective, I feel that unless there's a specific request from the patient for certain reasons, it is a much quicker surgery to get through. So we recommend for most people, unless they request it specifically, to opt for a straightforward small neck dissection and removing the thyroid. These would be the pros and cons, but again, if a specific person is requesting, or if this is a big deal for you, you can always opt for it, knowing the costs and all the other implications of it. The healing period after these thyroid surgeries, again, they depend on how big the tumors were. But in case your tumor or your thyroid gland was less than 6 centimeters in size, you can expect to go home either the same night or the next morning. When we do these surgeries, as you'll see, there's no major dressing. There's one small, tiny plaster that is put on the neck. And in some cases, if the tumor is on the bigger side, we may need to put a very small drain for one night just to make sure that because that empty space is left behind where we've removed the tumor, there's no oozing or no collection of blood or fluid into that area, which can later on get infected. 99 times out of 100, we remove the drain the next morning, we clean out the neck, and our patients are able to go home. From second day, once you go home, there is not really any restrictions from our side because this area is covered with a waterproof layer. So you can wash your face, you can take normal bath. Taking bath under a shower is completely okay, but we do recommend not submerging yourself in a bathtub. But other than that, you can do pretty much everything normally. Your neck will be a little bit stiff, so you can't really look up too much, but about 30 to 45 degrees on each side and up is completely okay. These restrictions usually last very limited time, maybe 3-4 days. At 1 week, when our patients come back in, we clean the neck out and we review the reports with them. And by that time, the scar already starts to look good. We do see all our patients back one more time 2 weeks out from there to check the final healing. But by 1 week, almost all our patients are back to normal work. So as a surgery, thyroid surgeries are very, very safe. They're very, very low downtime. So you are mostly going to be in the hospital one night. And once you go home, you don't really need much taken care of for the next few days. Usually 1 week is a good time to consider to give yourself if you're opting for a thyroid surgery, but that 1 week is not a bed rest time. It's just that 1 week where you need to take a break from your gym or working out, stuff like that. But overall, you'll have pretty normal life. These are absolutely painless surgeries, so we don't really give any pain medications for thyroid surgeries except for a little bit of anti-inflammatory, that is just to promote the scar healing quicker. So there are two things that we have to talk about. One is what happens for everybody and what are the risks associated. So if the entire gland is removed, then as we talked about in segment 1, you do need to take the thyroid hormone called L-troxin or Thyronorm or different brand names as per your required dose for your body for the rest of your life. There is no way around it because that is absolutely critical for your body to survive. If we remove half the gland and the other half is left behind, you don't need to do anything. You can basically go back to normal life and forget that a thyroid surgery was ever done for you. Now, considering the cause of the thyroid surgery, there may be different things. So if it's a non-tumor surgery, if it's half, you're done. If it's full, you may need to take the medicine, but otherwise you're good to go. If it's a tumor surgery, depending on what kind of tumor it is, there are different follow-up protocols that we have. Now, these follow-up protocols are fairly simple. Most of the times, they just require a couple of USGs in a year, and these keep updating according to the guidelines of the Cancer Society. So, most good doctors will be following these guidelines, and they're pretty standardized. So, once we do these surgeries, you will get a like a printed follow-up format for that with most good doctors, and it's very straightforward. You can just stay on that. So this is the most confusing question that people face when they're considering getting their thyroid surgery. Head and neck cancer surgeons, surgical oncologists, ENT and head and neck surgeons, surgical endocrinologists, general surgeons, maxillofacial surgeons, all of us do these thyroid surgeries. And pretty much everybody would believe that they are the best people to do that. So the question becomes that as a patient, which doctor do I go to? Who's the best doctor? Now, I am an ENT surgeon, so obviously you should go to the ENT surgeon, right? Not true. The fundamental things that you want to look at is it doesn't matter what exactly the degree of the doctor is, as long as it's a qualified and legal degree. Even if it's a surgical oncologist, suppose the doctor is doing more of breasts or gut, which they're specialized in, and they're doing 1 or 2 thyroid surgeries, a maxillofacial surgeon who is doing maybe 40 of these thyroid surgeries will 100% of the times be better. So what you're looking for is a doctor who's doing a large volume of these surgeries. Number 2, who has good results. Okay, and these are very easy to find in today's day and age. A simple Google search or going up on Practo or any of the other social media reviews can show you whether these are correct or not. Other things are simple posts on social media platforms would show you if the doctor is having good results or not. And of course, reputed places, reputed institutions are other good factors to find. But the fundamental thing that has been medically shown to give better results are doctors who are doing good number of surgeries. So it's a very simple thing. If any doctor is doing a large number of specific surgery, they will end up being better at it because they're just doing the thing more and more and more. So there is no one specific group of surgeons who are fundamentally differently trained. All these doctors, all these surgeons are doing the exact same surgery. They're doing the exact same techniques, and the thyroid surgery technique is an established internationally standardized technique. So rather than the degree of the doctor, it is far more important to look at the results of that specific doctor, and based on that, take your decision. Top 10 questions in thyroid surgery. These are the top 10 questions that I get asked most frequently by my patients for thyroid surgeries. Again, hopefully this could clarify these issues a little bit better for you. If you have any further doubts about your thyroid surgery, or if you would need to know more about anything, our WhatsApp and our email IDs should be somewhere on the screen. So feel free to reach out to us. I'll be back shortly with another episode of Top 10 Questions. Till then, thank you so much for taking the time out for watching this. We are Dr. Bhattacharya ENT Clinics, and thank you so much. Namaskar.